Good evening, everyone. So, my next video is on the topic of uses of physostigmine in brain. Means, what are the uses of reversible acetylcholinesterase inhibitor physostigmine in brain? And before I start my video, I want to request you, if this video is useful to you and if it is helpful to you, kindly subscribe to my YouTube channel, that is Dr. Nitika Pharmacology Discussion. And I hope you understand this video. So I'm going to start with uses of physostigmine in brain. As I have already discussed in the previous video that physostigmine is a lipid soluble tertiary amine. It crosses the blood-brain barrier. It crosses the biological membranes, that is GIT, blood-brain barrier, and of the eye, that is pupil. So it can be used in the treatment of the atropine poisoning as it crosses the blood-brain barrier, and it can be used in the treatment of the Alzheimer's disease. And in eye, it can be used in the treatment of the angle closure glaucoma. And first of all, now I'm going to discuss its use in the atropine poisoning. Whenever there is belladonna or datura poisoning, that is the acetylcholine receptors are blocked, that is muscarinic as well as the nicotinic receptors are blocked. Sorry, in atropine poisoning, atropine acts only at the muscarinic sites. So it blocks the M1, M2, and M3 receptors. In atropine poisoning, when these receptors are blocked, and it also act in the brain, that is the brain acetylcholine in the brain. When those receptors are blocked in the brain, we can give physostigmine. And physostigmine is reversible acetylcholinesterase inhibitors. 50% of the physostigmine it acts in the brain and 50% of it acts in the periphery. In the periphery, when it blocks the M1, when it stimulates the M1, M2, M3 receptors, the symptoms are reversed. That is, it will inhibit the breakdown of the acetylcholine in the periphery, leading to increase in these levels of the acetylcholine. So more acetylcholine will act on the muscarinic receptors. So peripheral symptoms will be reversed. In the brain, it acts on the acetylcholine receptors in the brain. Also, it will lead to increase in the acetylcholine levels in the brain also. If 50% of it enters the brain, it is a reversible acetylcholinesterase inhibitor. So convulsions, deliriums, and other coma, hallucination symptoms and excitation system symptoms are reversed. So in the brain, it also acts. So this was the use in the atropine poisoning, that is in the datura or the belladonna poisoning. And second use which I'm going to discuss is the use of the physostigmine is the Alzheimer's disease. Alzheimer disease, in our brain, there is basal nucleus of Maynard present in the brain, which is the storehouse of the acetylcholine. The lot of acetylcholine is present in this basal nucleus of Maynard, and M for Maynard and M for memory. It is responsible for memory, and these are there is a lot of cholinergic neurons in this basal nucleus of Maynard, and in our body, in our brain, at the time of the birth, there is maximum number of cholinergic neurons present in the brain. Means at the birth, our memory is more, and it is a maximum cholinergic neurons are present, and slowly these get degenerated with age. So with age, we can see that there is dementia because of the degeneration of the cholinergic neurons, and this dementia is also known as senile dementia, or can be used known as the Alzheimer's dementia, which is due to degeneration of the acetylcholine neurons in the brain. This is Alzheimer's disease, and for this we can give the drug physostigmine, but it crosses the brain only 50% of it. So it is less selective. This 50% acts in the periphery and 50% acts in the brain. So it is less selective reversible acetylcholinesterase inhibitor. So we can use the another drug which is 99, which acts 99% lipid soluble it is, and it crosses the blood-brain barrier. 99% cerebroselective action it is having. It acts on the in the brain. That drug is the Tecrin. It was the drug of choice for the Alzheimer's disease earlier, but now it has been replaced by some newer drugs. The reason for this is Tecrin is the shorter acting drug, Plus it is hepatotoxic, means it causes the liver damage. So now we use the newer drugs like these are cerebroselective reversible anticholinesterase inhibitors, acetylcholinesterase inhibitors, reversible cerebroselective. These are galantamine, rivastigmine, and donepezil. These are also reversible acetylcholinesterase inhibitors, and their selectivity is almost 99%. These are longer acting and these are more effective, and these are 99%. These enter the brain and these are cerebral selective, but they do not cause the liver damage. The advantages, these do not cause the liver damage, so these can be the newer drugs can be the treatment of choice now for the treatment of Alzheimer's disease. There's another drug known as memantine, which is NMDA receptor antagonist, which blocks the NMDA receptors of the glutamate and thus increase the release of the acetylcholine again in the brain. So that can be used in the treatment of the Alzheimer's disease. That was all for the uses of physostigmine in the brain, in the blood-brain barrier. I hope you understood my video, and if you understood my video and if it appeared useful to you and helpful to you, kindly subscribe to my YouTube channel, that is Dr. Nitika Pharmacology Discussion. Thank you. Be happy, be healthy, be blessed, be safe, be wealthy. Thank you.